are there really key things that could prevent breast cancer?
Yes, Fiona, there are actually. I mean, when people say prevention, I like to think of it as more modifiable risk factors. So
Love
there's really
that. Hello, everyone, and welcome to my YouTube channel. This is the Chayil Lifestyle Show, where real Chayil women living a Chayil lifestyle are coming together to have pertinent, purposeful, and passionate conversation on living life as God intended us to. Be sure to hit the subscribe button below and the bell to get an alert for more videos like this one. I really appreciate you dropping by my channel today. As you know, we've been talking about self-care on the blog this month, and it's Breast Cancer Awareness Month. So we definitely wanted to have a conversation of self-care around breast cancer, the myth, the facts, and questions that many of us have. So today I'm super excited to have with us our guest, Dr. Nwamaka Obi. Her official name, I always pronounce it incorrectly, but it's Nwamaka Obi. Dr. Obi is a certified OBGYN and assistant professor in OBGYN. She's a wife, she's a mother of 4, she's a prayer warrior, she is a committed worker in the kingdom of God, and of course, above all else, she's a Chayil woman. I definitely want to read a couple of her accolades because I think it's worth celebrating. I think it's so hard, as we know, to already fit into the role of wife and mother, but to have such a hectic career, to say the least. I think it's worth celebrating because she definitely juggles all of these roles well. So Dr. Obi is an MD, MS, FACOG. She is a graduate of the Ohio State University College of Medicine. She is trained in obstetric and gynecologist at George Washington University and maternal and fetal medicine at Loyola University Health System. She is board certified in obstetrics and gynecology and maternal fetal medicine. Currently, Dr. Obi actually works for the Innova Health System. She practices, her practice specializes in counseling, management, delivery, high-risk obstetric patients, including fetal diagnosis and genetic counseling. She is also an assistant professor of OBGYN at Virginia Commonwealth University School of Medicine, and she's a fellow of American College of Obstetrics and Gynecology. Dr. Obi is very passionate about women's health and believes in living your best, well-rounded life, which she does so well. And she enjoys reading, running, traveling, and of course, spending time with her husband and 4 kids. So thank you so much, Dr. Nwamaka, for being with us here today.
Thank you, Fiona. I am so excited. That made me laugh when you were trying to say my name.
I know, I'm so used to calling you Nwamaka. I'm like really struggling because I'm like, I gotta make this official.
That totally works out. You can call me Amaka, that's fine. So thank you for having me here. I'm so excited to be sharing with your viewers, and I'm really excited about this blog and this video. So this should be a good time. So that's awesome. Thank you.
Yes, definitely. I'm really excited just to get into the conversation again about breast cancer awareness. Really just, again, as I mentioned, talking about the myths, the facts, and just questions I feel like people always have out there, but really just don't have the platform or the opportunity to talk about it. So just to start us off, I wanted you to kind of just define breast cancer for us, layman's term, as well as maybe the more scientific clinical definition of breast cancer.
Right. So breast cancer essentially is just cancer in your breast cells, right? So pretty simple. And what is cancer? It's sort of a group of diseases that causes sort of a abnormal cell growth. So normal cells start to overgrow, and then they can invade nearby tissue or spread to other organs or other parts of the body. So that's essentially what the basis of cancer is. So breast cancer is then just abnormal cell growth in the cells, normal cells of the breast tissue that then can spread, invade the tissue around them, and can actually spread to other organs. So that's what breast cancer is.
Okay.
It is also one of the most leading cause of death, actually for women in the US is right after lung cancer, which is definitely more prevalent, and all over the world is the #1 leading cause of death.
Oh,
So
wow.
very, very important topic for us to be talking about today.
Absolutely, absolutely. So when breast cancer starts in the breast, you know, in the cells there, and it spreads to other part of the body, is it still considered breast cancer at that time, or is there, I guess, a new name for it? Because I have heard of stories of, you know, where it can start in the breast and move to the arms, the chest, just like other parts of the body. So in terms of the definition, how does that sort of get differentiated?
Right. So it is still breast cancer, but it's then thought of as what we call metastatic breast cancer, meaning that it's spread from its place of origin, which is the breast tissue, and now it's in other parts of the body. But those cells will still look like breast cells that are now abnormally growing. So we call that metastatic breast cancer.
Okay,
So
awesome.
you can have, you can really have other types of cancer in the breast, or cancer from other organs that then go to the breast, for example. But specifically breast cancer, we think, originates in the breast, but then can invade tissue and spread out.
Wow, that's, important point that you just made there of it starting other places and sort of ending up at the breast as well. So thank you for the clarity on that. I wanted you to talk a little bit about how race and ethnicity also impact your likelihood of getting breast cancer. A lot of the readers and viewers of our blog are women of color, and I've heard, I don't know if it's a myth or a legend, that perhaps women of color are a little bit more susceptible to getting breast cancer. Is there any truth in that? And what does race and ethnicity really play in your chances of getting breast cancer?
Right. When we talk about race, I'd like to kind of go back and talk a little bit about, like, what are the things that increase risk of breast cancer, right? So we're talking about this disease, and I'm sure that the viewers also want to hear about, well, what are things that can potentially increase risk. I think the #1 things we always talk about, and I'll come to race, is basically increasing age, one. So as we get older, the risk of breast cancer increases. #2, being female. So you and I, as women, have a much higher risk of breast cancer than our male counterparts. So I think those two things are the big risk factors. There are a lot of other things that we can mention, lifestyle things, smoking, of course, alcohol. Race is one of those things. And actually, there is a higher rate of breast cancer in the Caucasian population as opposed to the African American population, unlike what people will usually think. I suspect that just because the incidence of breast cancer has been increasing, or at least compared to many years ago, people feel like now, women of color feel like, oh wow, I have a sister, I have a friend, I have a grandma. It just seems like there's just more breast cancer, and I think we're starting to think that maybe this is higher in our demographic, but that's actually not true when you look at the numbers, especially in the United States. Of course, there's breast cancer all over the world, so it's in Africa, it's in Asia, but in the United States, there is a higher risk of breast cancer in Caucasian women more so than African American women. Breast cancer can affect up to, we say lifetime risk is 1 in 8. I mean, if you think about that, that's just huge, that we have a 12% chance or 12% risk of breast cancer in our lifetime. So of course, the older you get, that risk becomes a little bit higher.
Okay, thank you for the clarity on that. I think that's really helpful. I know that you just mentioned age definitely playing a huge part in your likelihood to get cancer. But I know it was so interesting. I think it was like last week, I was like on social media and one of my cousin's friends was celebrating her 29th birthday, but she was also, celebrating taking, having her last chemo treatment for breast cancer. And so I wanted us to talk about that age factor a little bit more. If you're in your 20s and your 30s, does it mean that you're exempt? I know that you're less likely, but what does that statistic look like for women in their 20s and 30s? And, we're not getting mammograms regularly at that time. So what are ways that you can kind of catch it early? Because I know that, that's something I'm sure we'll talk about a little bit later, but early detection is so important. But can you give us a little bit more insight on the age factor? Because it seems like nowadays, like no one is exempt. It's not just the 50s and 60s anymore. You're finding 20-year-olds, 30-year-olds that are sort of battling with breast cancer as well.
Yeah, I mean, I think that you're correct. I mean, there's just so many women now and young and old who are fighting breast cancer. And I think that, yes, we talk about older age. And yes, that's definitely what happens is that as we get older, the risk of breast cancer goes up. But women in their 20s and 30s can get breast cancer. And there are few, things that I think about when you think about younger age and risk of breast cancer. I think one of the things that we always think about as medical professionals is what's their personal history, what's their family history, right? So women who have a first degree relative, so a mom who has had breast cancer, a grandmother, so aunts, multiple family members with breast cancer, or even male breast cancer in their family, those women seem to have a much higher risk of breast cancer and even earlier breast cancer. Also, you think about the age with which their first degree relative had breast cancer, right? So if their mom was 30 or 25, then their chances are even higher that they could get breast cancer earlier. And then while you think about that, their personal and their family history, you also think about genetic mutations. We now know that there are genetic mutations or genes that can actually increase the risk of women getting breast cancer. And so, for example, I know some of your viewers have probably heard about BRCA1, and 2, which are breast cancer mutations. So these gene mutations actually increase risk of breast cancer in families. And many of those women, so women with BRCA1 mutations, have up to a 72% chance of breast cancer in their lifetime, which, when you hear, that's really high. And a lot of those women can get breast cancer early. BRCA2 mutations up to 69%. Wow. And so, it's not a disease of only the old, the young can get it. I think things that do increase your risk in those categories of younger people is what their family history is, what their personal history is. Do they carry a mutation that they don't know about? I mean, you can just get breast cancer even if you have none of these things, but in general, of course, risks are higher when you have these risk factors.
100%. That makes so much sense. So I wanted us to talk a little bit about the early signs. This is actually a question from one of the readers. I gave some, the readers the opportunity to kind of pose questions they would want to ask you. And so one of the readers wanted to know, what are early signs of breast cancer? What does that look like? What are symptoms that if you see it should sort of be an alarm for you to go get checked out?
I think one of the things, of course, is a lump. Everyone talks about the mass in breast cancer. As women, I always say it's important to pay attention to our bodies, right? Yes, you go to the doctor, yes, you get screening, but actually paying attention to your body is going to be one of the early ways you find out that something's wrong. I think most women will, feel a lump. It's hard. It doesn't really move. It has irregular borders. Those are, things that I would recommend that you talk to your doctor about so they can do an exam. So if you feel something different or you feel a lump in your breast, then for sure going to the doctor. Some women will notice a change in the skin surrounding their breast tissue. nipple discharge, especially bloody discharge. Those are things that really should be looked at. So I would recommend that they go, see the doctor. Now, some of the symptoms of breast cancer, when we think about breast cancer, by the time people are having significant symptoms, it may be that the disease is actually not early breast cancer anymore. So, when I'm talking about just a lump, we're talking really early signs. There are all kinds of symptoms of sort of more advanced cancer, whether that's abdominal pain, nausea, vomiting, weight loss, night sweats, all of those things. You're just not feeling well should prompt you going to see your doctor. I think probably about 30% or so, at least based on the latest literature that I read, 15 to 30% of cases were found because someone came in and said, hey, I have a lump, can you check it out? And they do an exam, they do more diagnostic studies and find out that this is breast cancer. So those are some of the things to look out for. Can it be asymptomatic? Yes. But again, I think paying attention to our bodies is key, because that's when you start to see, that the skin is different, there's a lump, there's discharge, things like that, that should prompt an exam.
Awesome, 100%. That makes so much sense. One of the things I did want to ask you about, because we touched on diet a little bit earlier, is, we always hear these things about diet and exercise being quote unquote important to preventing breast cancer. Is there such a thing? Are there factors that really could prevent you or lessen your chances of getting breast cancer, such as paying attention to your diet and exercise? I know we talked about smoking and things like that earlier, but are there really key things that could prevent breast cancer?
Yes, Fiona, there are actually. I mean, when people say prevention, I like to think of it as more modifiable risk factors. So there's really not
that's good.
You completely take away the risk, right? You can't, bring your risk to zero, but there are things that you can change about the things you do, right? Yeah. And so, when you think about risk of breast cancer, we talked about age. You can't change age. We're gonna get old. Every day I'm like, oh my God, I'm getting older. It's coming. So I can't change anything about that. But the modifiable risk factors, are things like, we talked about lifestyle changes, and I'll get to that, but there are a few things as women. Number one, we found that, if women breastfeed longer, that they decrease their risk of breast cancer. We don't.
Oh my gosh, that's so crazy.
But that's something to.
My cousin and I had a debate last night because she was breastfeeding my nephew, and I'm like, oh, he's such a big baby because he's over 1. And I was like, still likes his boobies. And she's like, breastfeeding decreases chances of breast cancer. And I was like, I'm going to ask Amaka about this tomorrow. I don't know if that's true.
Who knows her data? So for sure, she's correct.
Okay.
For sure, breastfeeding, and you can think of cumulative breastfeeding, right? So if you're like me and you have 4 kids, I'm sure I have like at least 3.5 years of breastfeeding under my belt. But in general, the thought is, women breastfeed longer, and that's cumulative. I think it's about 15 months or so on average, 15 to 16 months and longer, that decreases the risk actually.
Wow.
Another thing that can, modifiable factors are, when we have our first child. And I know that this is sort of a sensitive topic for women. In 2020, we're busy. We have careers. We have so many things that we want to get done. And I think overall, as a society, we're putting off having those children. And then for some women, it's not just that they're putting it off. It's because, it's not their time yet. The Lord hasn't blessed them yet with a child. But there is data that shows that the more we put it off, the older we are before our first full-term pregnancy, that actually increases our risk for breast cancer.
Wow.
So, when I read this data and I go through this data now, I'm like, oh my God, they want to push us back. They want us to go start having children at 19, 20, when we have so many things that we want to achieve. But you know, that's what the data says, that as we get older and we're trying to do these other things and push up having children, that unfortunately that does change it. So women who have children earlier have a lower risk of breast cancer. But what are the things that we can control? Exercise, right? I think that that's key, because not only does exercise help with your mental well-being, and it also decreases risk of different kinds of cancer. It keeps your weight in check, which we know that obesity is tied to all kinds of things, not just cancer, but also cardiovascular risk, hypertension, heart attacks, all of those things. And so exercise is key in modifiable risk factors. Diet is one I get questions about all the time, because people are like, you know, can I eat something special? Do I just take meat out of my diet? You know, and people swear by all kinds of different diets that this is the thing that's gonna, you know, prevent breast cancer. But I think that in general, you know, a balanced diet, they haven't really found specifically that there's one diet that's going to change your risk, right? But I think having a balanced diet, leading a healthy lifestyle, you know, no smoking, you know, alcohol use, those kind of things, or alcohol abuse, those kind of things definitely increase your risk. There's some thought that a Mediterranean type diet where, you know, it's plant-based, fish, you know, things like that may be helpful, but even the studies on that are not great. So in general, I tell people, you know, hey, I think if you eat healthy, you know, do some moderate exercise, you try to keep your weight down, that those things are positive, you know, for your risk of breast cancer, and really for a whole lot of other things. So there's definitely a lot of positives in different areas of life from doing just that.
That's awesome. Those were excellent, excellent feedback in terms of minimizing our chances, not necessarily prevention, but modifying our risk factors. I like that. Um, so I know when I go to see my OB every year, she'll always ask, "Are you doing self exams?" You know, they used to have the little hang tags. I think like back when I was in college, that just like hang to remind yourself to do breast self exams. So really, how important is that? And you know, if you don't feel a lump, obviously, as you said before, that's just really only one symptom. But does it really play a role in doing these self exams? Is just going to see our OB once a year sufficient, or you know, when you hit 40, getting that mammogram? How important are these self exams really in the grand scheme of things?
Well, you know, I think there's been lots of studies back and forth on, you know, breast self-exams key? Do they really change outcomes? I mean, I think we all agree that diagnosing something in its early stages is helpful, right? Because we see that outcomes are better if we catch something early, if we catch breast cancer early before its later stages in the disease. I think what breast self-exams do though is help you be in tune with your body, right? So we talked about this sort of awareness of your body, because that's the way that you're going to see, you're going to know if something's different. So, you know, I'm not going to shame anyone or punish anyone for not doing religious breast exams monthly, but I think having, you know, actually touching your breasts, looking at them, seeing what they look like, and being aware of them, I think is important, because if there are changes, that's the only way that you're going to know, because you've looked at it, right? I mean, I think recommendations talk about screening from about age 40 and on, and for younger women, there's really no screening guidelines unless you have a family history or something like that, and then you start earlier. And so really that's the only way outside of going to your yearly GYN exams. So I suspect, like I said, you know, 15% or more of new breast cancers are because someone felt a lump and then they went in. And so I think, you know, that it's important to just you know, be aware of your body, and it's important to know what things look like. You know, this is, God gave us this body, right? This is what we have to live in for, you know, 75, 80 years. And so really it's our responsibility to take care of it and know what it looks like.
Yeah, good stewardship. Yeah. I have another real question.
Exactly.
I mean, I'm like, women of faith, we have to be good stewards of our bodies as well. So yes, definitely. I have another reader question here, and it ties in with that hereditary side of it. You know, there are some cases that are new, but then there is the portion of folks that the mom has had it, the grandma, the aunt. So the question is, obviously, is breast cancer hereditary? Which I feel like you've touched on that a bit. So what I wanted you to talk a little bit more on is the screening process for someone that they've had an immediate family member, whether it's the mom, grandma, aunt, sister, that has been diagnosed with breast cancer, maybe has even lost, you know, a family member to breast cancer. One, can you confirm if it is hereditary? And then two, what should that screening look like, especially if they haven't hit the age of 40 yet?
Right. So that's a great question. And there are a couple of things, you know, that I kind of want to tease out of that. One is, if you have a family history of a first-degree relative or multiple first-degree relatives who have had breast cancer, and how old they were is going to be important, right? So if someone's mom had breast cancer at age 30, then really their screening should start earlier than age 30. Right? As opposed to the standard, you know, average risk person who starts around 40s. And so, you know, that history is important. If they had breast cancer that early, there's some, like I talked about earlier, relationship with, you know, breast cancer gene mutations. You know, it can be a touchy topic. You know, some people don't want to have this information because for them it's anxiety producing.
Yeah.
You know, they feel like, okay, what am I going to do now that I know I have 70% risk of this cancer and that cancer and all kinds of things. So it's a topic that I feel like, you know, is something that someone needs to sit down with the genetic counselor, sit down with the doctors and have a full conversation. So when I, you know, say things, I don't want this to be like this is it, you know, this is what, you know, Dr. Obi said on this talk. I think that it's important to have a full conversation because there are, you know, charts and things like that, and they can look at the whole history and decide if, you know, testing for gene mutations is something that's going to be good for that family. In general, though, the thought is that you test a person who's most likely, you know, to be positive. So if mom had breast cancer before age 30, maybe she should be getting tested to see if she carries a mutation, because then if she does, then there's higher risk of other family members carrying this mutation, and then they can go get tested. But that does, you know, it's an interesting dynamic, having met lots of families. Some people don't want to know, you know, some people get really upset, you know, some people get depressed and really anxious about results like that. So I think people have to, you know, it takes counseling and a discussion and deciding whether this is information that they want to know. But for sure, if you have significant family history of breast cancer or even male breast cancer, I think that, you know, early screening or earlier screening is going to be important for those families or for those people, and definitely starting earlier than the first case or the earliest case in that family.
Okay, awesome. I think that that's so helpful. I think that fear factor is huge a lot of times for people who have had family members who have gotten sick or even passed away from it. But I think, you know, just information is knowledge and it's power. And I think that you tied in two great pieces, which is the counseling piece as well as the medical piece, because you sort of have to talk through it and help yourself with that anxiety, because you know, you don't want to go through that same transition or process that your loved one went through, especially if you can catch it early. So I think I love that the counseling plus the medical feedback is essential in really trying to mitigate and figure out what does your history or your story really look like. Another reader question I had fell in line with the gene mutation conversation as well, and it was about the BRCA, which I know you've talked about a little bit, and I actually did quite a bit of research prior to our chat, and I was just fascinated about, because I've always thought that cancer was like a cell, or I think I was talking to a girlfriend, and you know, we thought that the BRCA, like having it was the cancerous piece, but really it's a cancer fighting component in our body that helps us fight against, you know, breast cancer, ovarian cancer, and things like that. But when there is a mutation in it, that is where our risk goes up. And so it was just so freeing to learn that. I was like, ooh, I should read up on these things more.
Knowledge is power, right?
It really is. It was such an aha moment for me. But so then the conversation came up, and this question was one of them on just how likely, if you have gotten tested already, so and you don't have the BRCA gene mutation, but you have the family history, just understanding what the likelihood looks like then. So it's like, you know, they've already followed up with the recommendation you just made in the last question. They've done the counseling, they've done the testing, they're having the conversations with the doctor when they don't feel 100%. They're going, hey, run some tests, but you know you have the family history. Is the likelihood still there? You know, how long should you continue that cautionary measure? What are your thoughts on that?
Right. So unfortunately, even if you don't have the mutation and you have a significant family history, the risk is still there, and that risk is going to be above average risk, right? So we think of average risk as people who really don't have, you know, family history. Another portion is actually heritage. So we know that Ashkenazi Jews, you know, potentially have a higher incidence of these mutations plus history of breast cancer. So that's, you know, another part of, you know, looking, you know, where you're from, things like that. And the thought is, so your risk is a little bit higher than average risk, but definitely not in the risk category of someone who has a gene mutation. So, you know, unfortunately, yes, the risk is a little bit higher, and that exact number is just going to be based on the person. You know, how many family members? Was there someone who was male? How old were they? You know, all of those things. And then looking at some of the other modifiable risk factors, right, that we just talked about. Do they smoke? Do they drink? Are they overweight? Are they postmenopausal now? You know, so all of those things are going to come in to really give you a specific risk. But in general, in someone who has a personal family history of breast cancer, that risk will, their lifetime risk will be higher than someone of average risk, which we think of around 12%. So that risk is going to be a little bit higher than that. And then it's going to, you know, depend on all other things, like where are they from and all the other modifiable risk factors that we've talked about already.
Awesome, thank you. That's excellent. If detected early, what does full recovery look like for breast cancer? You know, I know we've talked about all the things we can do to try to, you know, ensure we catch this early. So what does recovery look like? Because I think that's also the scary part for a lot of women. It's like, I get it, and they automatically think the worst case scenario, but is catching it early, I mean, obviously those chances are always there, the worst case scenario, but is full recovery possible, and what does that statistic really look like if we can catch this thing early? Thank you so much again for stopping by my YouTube channel today. If you've enjoyed the session, be sure to give this video a thumbs up, hit subscribe, and the bell button below to get alerts of more videos. Thank you again, and see you next time.